This group is amazing. Although I have been a longtime member and thought I had many answers, when I needed resources for my young adult daughter, you all really came through. It's so good to know that I have your support and understanding after so many years. Hello, I'm Lisa Franklin, Program Manager of Parent to Parent of Colorado, and that was a quote from one of our longtime Parent to Parent members. I'm pleased to share with you today the highlights of our statewide family support programs that are part of Ability Connection Colorado. These 4 programs were all created when families identified an unmet need and came together to form a program that could meet that need. Parent to Parent connects families of sons and daughters with disabilities and special health care needs to information and emotional support. Guardianship Alliance of Colorado provides training and guardianship services that protect the rights of our most vulnerable community members. Infantile Scoliosis Outreach Program provides training for the medical community to administer life-changing treatment for babies with progressive infantile scoliosis and provides support for their families. And Faith in Action provides information on medical transportation and other resources for individuals with disabilities. These programs work locally in the Boulder-Longmont area, across the state of Colorado, and nationally, internationally, to ensure that families and their loved ones can access the critical information and resources they need. Together, our statewide programs served 29,893 individuals during fiscal year 2021. COVID-19 continued to bring many challenges to our families and our programs in 2021. Because we've always had an online presence, our parent-to-parent program was immediately able to support families through the quarantine and home learning situations with accurate information and individual support. In addition, throughout 2021, we provided information from reliable resources on COVID-19 efforts, vaccination efforts, returning to schools, and mental health supports. Our Faith in Action program pivoted to taking calls for information and resources as volunteers were unable to drive people to medical appointments. Serving 127 people this year, the project coordinator continues to answer calls daily and connects people in the Boulder and Longmont areas with a variety of transportation and other resources. Guardianship Alliance shifted to providing online training for families and continued their critical collaboration with agencies and the court system on behalf of people with disabilities. Throughout the year, GAC served 1,970 individuals through direct guardianship work, information, and training for families. This program continues to expand to meet the demand for guardianship support and collaborates annually with dozens of organizations across our state. Recently, during a court proceeding, a family member commented, "We are fortunate to have this opportunity to work with GAC. Our family is grateful this program exists." Infantile Scoliosis program continued outreach, but found that limitations in hospital availability meant that some children were not able to participate in the medical treatment casting program. One family who did receive casting commented, "Our son wasn't able to be cured with casting, but in my heart, I know that it brought him a lot of precious growing time. He is doing amazing, and we are grateful to ISOP and all the amazing people we have met along the way." Overall, this program advised 1,400 families and 290 medical professionals across the world throughout the year. Throughout the pandemic, parent-to-parent saw a need for families to connect to each other. By providing both group and individual support, we were able to serve 17,236 individuals throughout the year. We continued to train peer support parents, and for the first time, we were able to provide a training class to parents who communicate in Spanish. This has increased our capacity to meet the needs of additional families who request a support parent. Peer parent support is the heart of parent-to-parent programs and gives a parent with a new diagnosis or who is going through a transition a critical connection to another parent who has been there and understands. Our support parents learn and practice the important skills of empathy, active listening, and being able to provide resources when needed for families who are struggling. One of the silver linings of this past year is the increase in the use of technology such as video conferencing that has allowed many more families to participate in support group meetings, focus groups, online training, and advocacy efforts on behalf of their children, youth, and young adults. A goal for us at Parent to Parent is to provide opportunities for families to engage in systems change and advocacy and to support them so that they feel confident sharing their perspectives with local, state, and federal officials. We had several opportunities for families to make a difference, including participating in stakeholder meetings around the impact of COVID on children and youth with special health care needs, sharing their parent perspective with primary care providers who are learning to treat mental health conditions, presenting to families at the annual Children's Hospital Summit on Family Advocacy, and participating in an advisory council to develop a plan for technology access for people with disabilities in Colorado. I'd like to close with an email we received this year from another one of our Parent to Parent members. She wrote, "Our son with complex needs is going to school with his sister next fall. He will be attending a special program at our neighborhood school. While this isn't what I hope for when I think about inclusion, I'm celebrating this big victory. What began as a difficult conversation and lots of dead ends eventually resolved with staff in multiple departments being educated about what inclusion actually is. They learned the importance of social emotional development and community building as aspects of education and how to work collaboratively with families. I'm not sure how much has actually shifted in the culture and decision-making process, but my son will get to sing in the choir, get dropped off in the same carpool lane as his sister, and have the opportunity to start being integrated into the broader community in our town. This couldn't have happened without each of you. Your advice, encouragement, and camaraderie that you showered upon my husband and I changed the entire trajectory of our son's life. As we say at Ability Connection Colorado, inclusion matters. Thanks in advance for your support of our statewide family support programs that help ensure all families and their sons and daughters are included and have their needs met in our communities."